today is about bringing together partners from health and social care and the local authority with private sector and industry and academia. They each have a different part to play in the development of services for care for people. And by bringing them together in a room like this, I think what we do is we pull together the energy, the thinking, the innovation, and by having a conversation together and taking the work together forward, we start to bring new ideas out to really benefit the people that need it the most.
Well, we're actually, as the Research and Innovation Office at the university, we're hosting the event today. So it's really exciting to have people from academia, private sector and the public sector coming together to talk about how healthy apps can be used to enhance healthcare really and social care.
The idea for today is that the first part is about the suppliers and the deliverers of technology to showcase what their products are, and for people from the public sector and from universities, local authority to have a walk around and go and find out what products there currently are out there.
So we connect into people's homes a set-top box through their TV. So we put a set-top box of remote control, and that gives someone a way to call through their TV to a care organisation. And on the care organisation you end up with a video connection which allows you to sit and talk to someone as if you were face to face.
My company or startup is called DAP. So I wanted to find out a bit more about what the NHS required and how I can go forward with it.
Yeah, one of our products which has gone to market is our emergency handbook with the Royal Liverpool. It's won numerous awards across the country, and feedback across the country has been fantastic across various A&E departments. So we're here to showcase mainly that application.
What's really unique about technology is it will work in areas, very remote areas. Provided you've just got enough signal to be able to get a voice communication through, then our system will work.
In collaboration with an NHS trust in the Northwest, we delivered the first public health campaign around these conversations to help patients and families start conversations earlier and then signpost them to information and resources.
We're great at the technical build, kind of producing the apps, coming up with the ideas for apps, but we need kind of that solid foundation. We need the apps to have kind of relevant outcomes and potentially kind of routes to kind of market and commercialisation.
And what we're hoping to do is find out from our public sector partners what the challenges are, what the issues are, and what areas they're wanting to develop digital technologies and services.
An idea of what can be done. The word yes, basically. There's certainly been some ideas floating around, and I've met some real app developers as well. I heard they were all in like darkened rooms and fed pizzas and chocolate and stuff like that. But clearly they're human.
Basically, it's to look at what opportunities there are for our patients and to see if there are any companies that we can work with or we can trial their ideas so that our patients can benefit.
And for us, it's about creating an environment which can really help to shape this work going forward. We also had Lancashire Care presenting, and they've been a co-partner in developing today with us.
And that's the proposal we have. If we can develop something with you guys that's fit for purpose technically and future-proof, but also fit for purpose in terms of clinical and service user patient needs, we'll have a market-beating product on our hands.
We've also got the DACA and we've got Graham Diath presenting.
So we've created DACA to represent people across the whole of the marketplace, and principally it's about doing things once. And that starts with things like capturing requirements. So what are the issues that everybody is facing, rather than individuals trying to address those issues themselves. So with over 250 members already in 2-3 months since we launched DACA, it shows how a body can come together, work together, and actually move the agenda of moving to a digital health and social care system forward.
This is only the start of a journey about digital technologies. This isn't the end, this is the beginning.
You know, I find forums like this are exceptionally important for us to be able to come along, listen to what other people are doing, gain some knowledge from that, have conversations, meaningful conversations with them, and then link up this thing of people doing research and development and then the practicality of application of that. To link those three things up is incredibly important.
Well, I think it's been a great opportunity to network and meet with people from different sectors in this field of work. And also we've got a great deal of work happening with SMEs and companies who are already developing applications with our Media Innovation Lab. So I think it'll really enhance, and it's been a great opportunity to meet people.
There were some things I'm going to look at some of the technical barriers that stop small to medium-sized enterprises engaging with the NHS and helping to deliver solutions that clinicians need, doctors and nurses need.
Well, the fact that perhaps we need to do more of this, really, because we need to bring these two groups of people together in these sorts of spaces so they can talk about the issues.
You know, it's raised more questions than anything else, and that's always a good thing. Come again, yeah. Thanks, cheers.